Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to go over an exercise that really helps our patients feel what it's like to really load the hip in a rotated position rather than kind of loading and twisting through the low back, which can typically cause pain. So what we're going to need for it is a band, okay? So we're going to attach that band to an anchor point, and then in order to set this up, what we want to do is think about the foot that's closest to that anchor point is going to be the foot that's forward, and then the other foot goes back is just kind of like a support. But most of the weight is going to stay on my front foot here. So in order to set this up, I'll pull some tension on the band. We'll need to set the core just to make sure that it's not going to immediately pull us in toward it. Then what we're going to do is make sure our foot position is good. So we want to make sure that we're really kind of digging in by pushing our big toe into the ground to kind of keep a strong arch. So the arch shouldn't collapse in and weight shouldn't be too far out toward the outside of the foot to kind of cause the knee to shift out too. Okay, so foot in a strong position, slight bend in the knee. Then the first part, there's going to be two parts to this exercise. So first part is we want to think about slight bend in the knee and then sitting our weight back toward our heels as we shift or hinge our hips back. Immediately in this position, you're going to feel core start to brace a lot, but you're also going to feel it right on the outside of the hip, okay? So that's where we want tension. If you're feeling it up into the back, reset and think about being able to keep a neutral back and shift weight back toward the heel as you hinge back in that position, okay? So first step, hinge into it. That's where we'll feel that glute and hamstring start to fire. Next is rotation. So we don't want the rotation to happen in the back, we want it to happen in the hip. So this is where the band comes into play. I want to slowly let the band pull me into hip internal rotation and then push out against it by squeezing my glute, squeezing my hamstring, and pushing my heel through the floor to be able to stand back up, okay? So what that looks like, I'll show you on this side, is we hinge back and then our hips are going to rotate versus our shoulders and our torso, okay? So that band, if it's attached where the camera is going to pull us into it, sinking into that back hip and really feeling it through the outside of that hip all the way down into the foot where we feel all those fascial planes start to really contract and tense. Then, rather than lifting the chest and extending the back, we're going to push from that back hip to stand back forward. So the key here, again, is making sure that I keep most of the weight on that front foot, hinge back and sit the weight back toward that heel, and then as I rotate, that hip is going to get loaded, and then I'm going to spring forward, squeezing the glute at the top to take the pressure off of the back. The reason that this is so helpful is because we have to get in a loaded position in the hip in order to avoid rotating through the back. A lot of common injuries through rotation sports are too much rotation through the back, and that's where we kind of place the emphasis. This helps to mimic a little bit more loading of the hip to be able to drive that power through without compensating with the lower back. So give it a try. Let us know how it feels.